Thank you for joining us for Unite for Sight's webinar about lessons from the field, how to pursue a career in global health. We're thrilled to have all of you with us here today. My name is Amy Bellman Davis, and I am the Executive Director of Unite for Sight. I'll briefly introduce you to Unite for Sight, review the webinar logistics, and then we'll hear from our 4 expert panelists. Unite for Sight is a global health nonprofit organization that promotes high-quality care for all. We offer extensive global health and social entrepreneurship education programs. Our Global Health University program offers a free webinar series, including today's webinar. We also offer 20 online certificate programs for students and professionals. Many students receive academic credit for completion of our certificates, and professionals often pursue the certificates for professional development. The certificate topics range from a certificate in global health to a certificate in responsible NGO management to a certificate in cultural competency. Additional educational opportunities for students and professionals include participation in Unite for Sight's annual Global Health and Social Entrepreneurship events, which focus on responsible global engagement. Our 16th Annual Global Health and Innovation Conference, which is the world's largest global health and social entrepreneurship conference, will be on April 13th and 14th, 2019 at Yale University. The conference includes 300 speakers, including our 4 panelists today, and more than 2,000 participants for a weekend exchange of ideas across all disciplines of global health, international development, and social entrepreneurship. The conference website may be found at www.uniteforsight.org/conference. We also have healthcare delivery programs that provide care to patients living in extreme poverty. We partner with phenomenal local eye clinics in Ghana, Honduras, and India to provide quality eye care to patients who are otherwise unable to access or afford care. These programs are locally led and managed by the local medical professionals, and our collaboration has provided eye care to over 2.5 million people by local doctors, including more than 103,000 sight-restoring surgeries by local ophthalmologists. Unite for Sight is the world's only organization that is a healthcare delivery organization that also offers immersive global health education and social entrepreneurship opportunities for students and professionals. Participants support and learn from local doctors in Ghana, Honduras, and India as they provide care to patients living in extreme poverty in villages, slums, and refugee camps. Participants learn from the local medical professionals about patient barriers to care and about effective strategies to reach patients who are otherwise unable to access or afford care. The local doctors are social entrepreneurs who design effective and innovative strategies to eliminate patient barriers to care. Now I'll describe the basic logistics of this webinar. We're so delighted to have all of you with us today. We have 4 amazing panelists, and they have a wealth of expertise to share with you during this next hour. Each of our panelists today will give a 2-minute introduction about themselves, their current role, and their key guidance and advice about career development. We'll then dedicate the remaining time to your questions and answers. We received stellar questions already submitted from you, our audience, by Tuesday's question submission deadline. We selected the most common and most thoughtful questions to ask our panelists. We also invite you to submit additional questions in the text box on the left of your webinar screen, and we will include some of those questions in our discussion today too. We also encourage you to tweet about the webinar, including your key lessons learned, by using the hashtag GHUWebinar, and you can see the hashtag in the webinar visuals on your screen. We'll proceed with having our panelists introduce themselves in alphabetical order. I'm delighted to introduce to you our first panelist, Dan Pawson. Please begin by introducing yourself, your background and current role, and please share your key advice or lesson learned regarding career development.
All right, thanks, Amy, and hi, everyone. So my name is Dan Pawson. I'm a Vice President at Global Health Strategies. GHS is a communications and advocacy global health consulting firm focused on global health. I work mostly with nonprofits and foundations on infectious diseases, universal health coverage, drug discovery, building interest in the issues, bringing people together into coalitions, and ultimately influencing policy. So I've been at GHS for about 7.5 years. I started as a senior associate, now as a vice president for the last 2 years. My background is not in that. So my background is actually in law and in politics. So I got my law degree, and I worked in the Massachusetts State House for a while, and then came to global health when I moved to New York. And so my advice is somewhat related to that, which is that your career is likely going to move in a zigzag with some fairly unpredictable opportunities, and that is fine. Keep an eye on where you want to go and the things that motivate you in your career, whether that's doing good, whether or not that's building your skills, but don't be afraid to take an opportunity, even though it's not in that straight line you may originally envision. And then get everything you can out of whatever opportunities are provided to you, because as you advance in your career, and I've definitely found this changing careers, nearly every imaginable skill that you can develop becomes an asset that then is part of who you are later in your career.
Thank you, Dan. Mark, would you like to introduce yourself next, please?
Sure, and a pleasure to be on and to share with everyone today and to be on with my fellow panelists. My name is Mark Roithmayr. I have the privilege of serving as the Chief Executive Officer of the Alzheimer's Drug Discovery Foundation. I've been in this role for the last 2 years. The Alzheimer's Drug Discovery Foundation is a venture philanthropy started by the Lauder family in New York. We fund solely in what's called the Valley of Death, and that is preclinical and early-stage clinical trials as it relates to dementia and Alzheimer's. And as I said, it's a privilege serving in this capacity. I've been 36 years in working for nonprofit voluntary healthcare agencies like the March of Dimes and Autism Speaks, and the Leukemia and Lymphoma Foundation Society. And I started my career as a marketing communications person. I remember early on in my career in nonprofit, somebody said, if you're in marketing communications, aside from the CEO or the executive director, you're the only discipline within a nonprofit that works on every single thing in that nonprofit. You have to know all the programmatic activities that you go on. You have to understand all the development opportunities that go on. You have to understand the finances. And little did I know that being told that early in my career, that advice actually led me to the corner office and being a CEO. This is the second time I'm a CEO. I served as the original president of Autism Speaks when it started in 2005 as a startup. I was the third employee ever and left that organization after 7 years, 200 employees and raising $70 million a year. So a real chance to go from a very established brand like the March of Dimes, where I served for 20 years, and then over to an organization like Autism Speaks, which was a startup. I also served 4 years as a chief development officer at the Leukemia Society, where I learned venture philanthropy. Gives you the sense of my career. What I will tell you, and a little bit later when we get into some other questions, I suspect I'll talk a little bit about my mentor, but the greatest career advice and the thing that I would pass on to everybody and anybody on this phone call today, I learned from a wonderful mentor who said to me at a point in my career, one of the greatest business skills you can have is to listen. And so often when we're going through our career, and particularly early to mid-career, we appropriately have a lot of ambition. We see the job we're doing and how it's contributing, but we could see more than we want to do. And we always want to be kind of offering what our thoughts are, what our skills are, what our expertise. And this concept that as you're coming up in your career to sit back, listen, hear all the other opinions, because once they're all out, you have lots to choose from directionally. And the other thing I learned from my mentor that was related to listen, because when you speak, you can't get the words back. They're out. But if you hold them back, you can always go back and add whatever you want to add. So sit back a little bit more, listen a little bit more, absorb what you're listening to. It'll help you develop strategically.
Thank you, Mark. Excellent advice. Eliza, would you like to go next, please?
Hi, everyone. I'm calling in from Providence, Rhode Island, and I'll get into my current role in a moment, but my background is I'm an artist and designer, so I studied at the Rhode Island School of Design, which is an art school. My focus was textile design, And as a student, I started volunteering with an organization called GAIA Vaccine Foundation, located in Providence, which does infectious disease prevention in Mali, West Africa. So as a textile student, we developed textile patterns that we started to brainstorm how to use in health campaigns to educate the population about different infectious diseases. And after graduating school, I actually started working with the organization, and that has led to my current role. I've been with the organization for 4 years. And so my work has been largely administrative with the organization. I've done a lot of brainstorming and grant writing. Our team is very small. We're just 4 employees. Some of them are part-time. But I have been able to use textile design in some of the health outreach, health education programs that we run. So I'm currently in a transition where I'm working with a new director who will be taking over from me, and I'm starting a social enterprise to offer design services to a wider range of global health organizations. And part of the goal of this social enterprise will be to work with local artists, perhaps all over the world, depending on where we have projects, to integrate local artwork into visual health messages. So part of my advice would be kind of how I've gone through things where there's a lot of challenges associated with working with a small organization, but in many ways that allows for a lot of learning. You can kind of see things from the inside, see all the different roles. That's helped me conceptualize what a nonprofit is and how everything works. And then another big aspect would be to really identify what your interests and skills are, and that comes from all the different experiences that one has over time, and really pinpointing where the focus and the interest is to kind of help shape a career, and that's kind of helped me move from my past position into my current position. Thank you.
Thank you. Rebecca, would you like to speak next and tell us a little bit about your background?
Yes, I'm Rebecca Ware Robinson. Amy and Unite for Sight, thank you so much for coordinating this. It's a pleasure to be on with the other panelists. And to all of you who are listening, thank you, and it's a privilege to have you in the global health field. So I work on drowning, which is the global epidemic that nobody has heard of. In the 11 years that I've been working on it, it evolved, and so that I started my own nonprofit. I'm the president and founder of Make the Minute Matter. We do awareness, education, and raising funding for skills-based training programs. I have a BA in finance in German from the University of Illinois, a master's in international management, marketing, and economics from Kellogg School of Management at Northwestern University, and a master's in organizational and social psychology from London School of Economics. I have 10 years experience in business consulting, particularly in human resources and organizational change, and then 11 years in the drowning prevention field. And my advice is 3 things. 1, follow what sparks your curiosity. 2, ask stupid questions. That's how you challenge the status quo. And 3, challenge your own weak areas, because you learn more from that than you do if you just follow your strengths.
Fantastic. Thank you, Rebecca. Thank you to all of our panelists. As you heard, they all have a wealth of expertise and guidance to share with you today. We'll now proceed with the question and answer session. As mentioned, we received questions in advance from you, our audience members. If you have additional questions, please post them in the text box on the left of your webinar screen. Mark, the first question is for you. What do you wish that you knew at the beginning of your career? Looking back, what would you want to tell yourself at the start of your career?
Well, first of all, these are fabulous questions, and I'm sure I speak for all the panelists. It makes you do a little bit of soul searching, but just as Rebecca just did wonderfully there, I will answer in 3s, and I'll put out all 3, and I'll go back and put a little flesh on each. The 3 would be: 1, careful of what you wish for; 2, And this too is going to sound a little controversial, but you learn more from a bad boss than a good boss, and I'll come back to that. And 3, the value of a mentor. The number 1, careful of what you wish for. When you work, I have found, when you work in nonprofit, whatever your job is, if you can master what that part of the job is, always more hands are needed, right? There's never enough resource in nonprofit to cover everything that needs to be done. And therefore, one of the joys of nonprofit, you can master what your job is, but then you can start getting involved in a lot of other things. And Rebecca just talked about it, get out of your comfort zone in some of those things. But it's funny, as you start getting involved in them, again, you can see what's ahead of you. And sometimes, very much in nonprofit, if you're good at what you do in one area, they just start kind of promoting you, and now you're managing people. And it does the careful of what you wish for. Think it out what you want, but as you start getting there, I know it is my own experience, you see everything as bright, shiny objects in that next job, that next promotion. But with more responsibility comes a lot more stress, a lot of other things outside your comfort zone that you'd have to take on, so it challenges you. So a little bit, it's not a bad thing. I think they're good things, but careful of what you wish for is number 1. 2, learn more from a good boss than a bad boss than a good boss. I remember when that advice was given to me. And I'll tell you, I kind of was angry about the advice when I got it, and I somewhat resented it because note to self, I was going through a period of time where I didn't have the best boss I ever had, and somebody who had been through a lot of experiences said that to me. And I'll tell you, I look back on my career, and it's true, okay, and learned how I had to adapt and still flourish in that situation, and also learned of when I get in these positions, I'm not going to do it this way. And again, I've had some great bosses, and don't get me wrong, I learned a lot from them, but the things that stick the most were in those tougher situations, particularly the leadership things that stick the most. The last part, the value of a mentor, I was probably a decade into my career, and I met somebody. I was at the March of Dimes, and this is the person at the March of Dimes that had talked the March of Dimes from curing polio and reinvented the organization into what it is today, which is working on birth defects and premature births and infant mortality. And when I had first met him, I got to spend a little time with him, and he was retiring as president. And I realized I spent about the first 10 minutes I spent with him, I thought, I'd like to meet with him forever because there's nothing I'm going to go through in my career that this individual hadn't been through. And he passed 3 years ago at 93 years of age, but I can tell you, the value of a mentor is just tremendous. And that mentor can change along in your career. You can make that mentor situational to where you are, but having a mentor is invaluable.
Thank you. Wonderful. The next question is for Dan. What are some common misconceptions about a career in global health or about the field in general?
Sure. Thanks, Jeremy. So in terms of misconceptions, just to give a sense of the people misconceiving, in my mind, the people I deal with, otherwise very intelligent people who are just totally outside the field and know what sort of an average, I guess, American who doesn't really engage in health and science would know. I'd say the 2 misconceptions that I get most often are really a lack of awareness of what the problems are, a lack of awareness that some diseases still exist. So I've done a lot of work on polio eradication communications, and by far the most common thing that happens when I bring up polio is there's still polio. And a day after World Polio Day, I hope that everybody knows that there is still polio, but it is surprising how many people in the U.S. don't. And then also that people don't understand the scale of some diseases. So people understand that tuberculosis is out there, but whether or not they understand that a third of the world has latent TB, or that it is the leading infectious killer, or any of a number of other things, they just have no conception of that. And so I think they just have a warped feeling about what global health is and what the problems are. The second misconception, I'd say, is that when I get into it with people, they tend to think that it is a little bit more of a delivery or a funding problem, in that if we could only just give more money to it, or we just got to deliver these things we already have to people. And the exception there is an AIDS vaccine, because the problem is so prevalent in the U.S. People have sort of internalized that. But on most other diseases that we communicate with, I think people don't realize how much hard science there is left to go. And I don't mean to denigrate how important complicated delivery is, because it is an incredibly difficult field. But I think people get that we need to deliver things, and I don't think they understand how much hard science is left in malaria or tuberculosis or neglected tropical diseases or any of the other things that we work on. And the last thing I'll say is, when they do think about R&D, it is more of sort of a global north, Europe and America and Japan doing research and development, and then affected countries just sort of being the recipients. And that's a very wrong way to think about it. There's amazing research being done in India, Brazil, Uganda, Tanzania, South Africa, China, and so they have sort of a warped idea of where the R&D and the new drugs, vaccines, diagnostics, whatever, are being developed.
Thank you. Eliza, the next question is for you. The wide range of potential careers in global health can be overwhelming at times, especially since there is no longer one traditional route. What advice do you give to individuals trying to figure out how to translate their interests and skill sets into a global health career?
Well, that's a really great point, that there's kind of more and more careers all the time, and it's a really expanding field. I think everyone would wish that we kind of woke up and knew exactly what we want to do, but that's pretty rarely the case. I think if you don't necessarily know what you want to do, but you at least have a sense of a few things that you don't want to do, that's a good start. And then certainly lots of different types of experiences, volunteering, internships, jobs, are all great ways to kind of narrow that list of things and kind of try different things, evaluate what worked, what was fulfilling, as a way to figure it out. For me, I'm very much inventing my career as I go, and that's the beautiful thing about this new world of social enterprises and entrepreneurship. There's so much support and interesting programs out there to kind of help people create new careers where those careers don't exist. So it really is quite broad, and the only advice I can give to navigating that is just to try a lot of different things and kind of narrow things down one by one.
Great, thank you. Rebecca, I'm going to ask you the next question because I know that your career has taken a few turns. In hindsight, what were the turning points early on in your career that have gotten you to where you are now?
That's a great question, and it's interesting because I think that if I were to think in hindsight, I finally got to where I should have been at the very beginning, because I have been an activist, an advocate for children since I was a child. And yet I took a career path through business, through some of the more expected things, and it wound and followed the things that interested me. When I worked in consulting, I realized that you could have the best business model in the world, but if you couldn't convince people to change, you didn't really have a model. And so doing that, I then ended up in the drowning prevention field, which adversely affects children, and have been able to use all of my skills, all of my business and my organizational social psychology and my consulting skills back towards what has always driven me, which is the activism, it's the advocacy for children. And so I look back and I see enormous value in having followed what interested me, but also realizing that at the end I came back to what was one of my core values.
Fantastic. Thank you. Dan, I'm going to ask you the next question. Do you think that hiring managers in global health organizations value undergraduate degrees in global health, or is the substantive area less important than the general skills developed, for example, writing ability or critical thinking?
I've been on our senior management, which is our sort of hiring committee, for about 5 years. At this point, I've probably hired more than 100 people over that time. And I would say global health knowledge that substantive knowledge is terrifically helpful. And when we see it, we're very excited about that. And obviously, a lot of the people who apply to work here are people who majored in global health or who have had an MPH or otherwise have a history in it. And we like that. But I would say that the knowledge about global health is probably more obtainable through reading and hard work than learning how to write or how to manage your time or exercise judgment or be able to give strategic advice to a client. And that's sort of what we've learned through experience. I mean, we work on maybe 20 or so different diseases or issues. And while there are definitely similarities between the two, they are different. And it's not a huge deal for us to swing somebody from one of those specialties to another. And to be honest, our team leads usually prefer that to a new person that they don't necessarily trust yet, because they know that those core skills about being able to work professionally are just a little bit more critical to what we do. I think it'd be pretty dumb for us to stop hiring for global health knowledge, because that really is terrifically helpful to us. And of course, the best is to find somebody who's got all the skills and all the knowledge. And I think global health knowledge and experience is something that shows us something very important, which is that you're passionate about what you're doing. And I think that's one of the core things that we try to hire for. But if I had to pick between the two of them, somebody who didn't know that much about global health but seemed in all other respects to be a really excellent candidate, and somebody who's really an expert but didn't have some of those skills that we look for, I think I'd lean a little bit more towards those other pieces than the global health knowledge. Great,
thank you. Eliza, our next question asks, is it essential to have international experience to pursue a career in global health?
I'm so glad you asked me this question, Amy. So I think the most important thing is the development of empathy. And certainly that can happen through an international experience where your eyes are open to the logistics and the situation and people and experiences and how those might be different in different places. They have different amounts of resources. But I think that can absolutely happen here in the U.S. or in any developed world as well, because there's tons of opportunities to connect with immigrant and refugee populations. There's so many volunteer opportunities. Certainly you could travel just a matter of blocks in your home city and connect with different international populations that could give you this different perspective and that could help with that creation of empathy and understanding of how situations differ across cultures. So I don't think it's essential, but I think it is essential to pursue those opportunities to really connect with people who have different lived experiences and different access to resources.
Thank you. Mark, the next question is for you. If you could change your career preparation or early career, what would you do differently, if anything?
Another great question. It's interesting, and I think your last couple of questions were toying around this concept of kind of real-life experience in nonprofit, bringing attributes like passion and empathy to it versus maybe being specifically degreed in the area that you're in. And I just kind of want to weigh in on that as a way to answer this question. The weigh in on that, I will say I am watching in the career that I am, and particularly over the last 10 years, more and more people are getting more specifically degreed, and I think there's a little push and pull that goes on in that. I think there are a generation of people coming into the workforce that going to school and going to extended periods of school is more and more and more the norm. It used to be, when I first started in nonprofit, there were only in certain areas where you would have advanced degrees or degrees specific to what you were going into. So I think that's becoming more of a norm. But I just want to go back to what our last two speakers said. I think bringing the intellectual curiosity, bringing the passion, bringing the empathy, bringing the wanting to learn, those things, they're invaluable. They're absolutely invaluable. And you'll go far in this field if you consistently bring those every day to what you're doing. So those things early in the career, I don't know when I fully grasped everything I just said to you, but having that a little bit earlier on in my career would have been helpful. This other piece of networking with others in your career that are not part of your organization but are in similar organizations. Finding that earlier would have been helpful to me. I ultimately did find that, but certainly would have been helpful. And then I will say a concept for everybody on the phone that I got there out of need and actually being promoted into a job that I was probably a little bit over my head in, but that took a while to get there. And it's this concept of a personal board of advisors. That I have it now, but that you put around yourself a group of people, at least 2 and probably not more than 5, that know you, and I mean know you, and also care about you in your career. And it's a mix of personal and professional, so that as you're experiencing whatever you're experiencing at work, you have a trusted group of people you can go to outside of work to say, okay, I'm experiencing this HR issue. And there might be somebody who's an expert in HR that you know. Or I am experiencing this conundrum with funders, right? And it might be somebody who's a funder, not a funder where you are, but a funder who can help you think through these things. 2, I have found, and I wish I would have seen early in my career, I can't solve it all myself, but there's other people who are expert and have an interest in me that will. Having a significant other that you can bounce these things off of, who knows you, right? Because we work in a very passionate field, each of us in our own way. We're trying to do something to better, if not save the world, whatever it is we're doing. You can get very caught up in that every day, right? And you need somebody that's outside of that ecosystem that you're with day to day, who can give you some perspective at different times. It'll make you the best, not only make you the best professional you can be, it'll make you the best human being you can be.
That's fantastic. Dan, I'm going to ask you the next question. What do you think are the most useful, applicable, and fundamental skills to develop early on in a global health career?
I guess a couple of things. One is I can't recommend the advice enough to be curious, to talk to anybody who will talk to you, to whatever you're given, dive into it, learn as much as you can about it, do the best job you can at it, and just figure out more. You are at the point in your career where everybody, and you should never actually really lose this, the humility to ask people what they mean and admit you don't know things, gives them the joy of teaching you. But continue to be curious and try to understand as much as you can, and that will be a skill that you will apply for your entire career. I will say it is easy to sort of get, and I realize I just said, get really deeply into whatever you're doing, but always think about the larger picture, because I think most people, and I think you hear this on the phone too, move from one issue in health to another, or between health and development, or whatever it is. But think about the broader landscape, things that will be applicable no matter where you are, the international politics that go around with health, some of the bigger systemic issues in drug discovery and education, and whatever it is, the big funders and their agendas, because this will help you understand wherever it is that you go. And this is something that you get a lot. There are publications and papers you can follow. A lot of this is from following really smart people on Twitter who will tell you what's really going on, and it's from talking to people. And I think these are skills and these are approaches that will pay off for you in the long term.
Thank you, Dan. Eliza, we were hoping you could talk a little bit about your mentors and how they've affected your work, and what you think are the most important qualities to look for in a mentor.
Yes, I've been lucky to have many different mentors, and to me it's been important to have mentors across a wide range of professions. So I work directly with the organization's founder, and she's a doctor and immunologist, and then I have I have mentors who are more in the design world or more in the field of textiles. And it's so important to get all those different opinions and feedback on my current path. One of the most important qualities to look for in a mentor is time. Do they have time to be your mentor? But I mean, that's hard because everyone is so busy and it's definitely challenging. But in my experience, students and young people are often timid or shy about reaching out and asking to have lunch or asking for a letter of reference or asking to meet up. And I think that it's absolutely their right to pursue mentors and ask for that time. And sometimes it takes a few emails to get someone's attention or to coordinate schedules. But absolutely, I think any professional is always happy to give that time to meeting up and chatting and really giving that time and attention to a young person, because we each have received that from other people throughout our career. So if you're a young person and you're pursuing someone as a mentor, definitely don't be shy and kind of persevere in getting yourself into that person's calendar, I would say.
Thank you. Rebecca, it is not uncommon to hear that global health professionals originally pursued a different type of career. What influenced your change in career focus, and what advice would you give to someone who is thinking about making a career shift?
Great advice, Annette, or a great question. It certainly follows my path, and it ties back to a comment I wanted to make about what I was saying before, is look at how your background fits into the problem which interests you. And so, like I said, I did not start in global health. I ended up in global health after 20 years. And when I and trust me, nobody goes into, I want to grow up and go into drowning prevention. It just has never happened. So once you're in a field that grabs you, like drowning prevention grabbed me, I started looking around. I did a ton of research into the field, looked at all the moving parts, started to understand the issues, talked to people, tried to start putting all the pieces together. And then I thought, how do I fit into this? What skills do I bring into it that are actually going to make a difference? So in my particular case, and I hadn't set out to learn to be an expert in social marketing or to learn social marketing, but I looked at the fact that drowning is an epidemic that nobody knows about. It needs to be marketed, and the solution hinges on very simple behavioral change. So I looked at my background, which was primarily the business and the consulting side and the marketing. You know, I had studied marketing and done a lot of that, and then also understanding how you change behavior, which also goes into the social psychology. So for the definition of social marketing, it's harnessing the power of marketing to change behavior for public good. And so I realized, okay, I know what the issue is within global health that I'm going to work on, and I look at the skills that I have developed over the years. How do the two fit together? How do I best use the skills that I have developed to fill a niche, to fill an area within my field that is not addressed, or which needs to be strengthened, or which needs to be looked at in a different way? And so for people who are looking at pursuing a different career, I would recommend that you take a very hard and unbiased look at what you have accomplished, you know, as if you were looking at somebody else's resume, and pull out the strengths, pull out how the pieces go together in a different way. So in my case, somebody might say, all right, international management and social psychology, I'm not seeing it. And people in my field didn't see it. I sat them down and said, this is why you need my skill set. And from that, people were starting to be more open about like, oh, I get it. If we start to integrate social marketing, we will be able to start working together as an entity on consistent consistent messaging and everything else. And so I would say consult on yourself, consult on your own resume. Look at it with a fresh pair of eyes at your interests, your hobbies, your academic background, your professional experience, and see how it fits together. Look at the field you're interested in going into, and then basically market yourself. Here's how I can be of use to reach an untapped area within that field.
Great. Thank you. Mark, the next question I'm going to give to you, do you have any specific recommendations for second or third career public health professionals moving from a field-based healthcare career to a U.S.-based leadership position?
Right. And again, I encourage also the other participants on the phone to chime in here, because the best way I can answer this from my own experience is talking about work I did within a domestic United States charity, the March of Dimes, where I twice moved from field-based positions, once early in my career, once at another time more of my mid-career. I moved from field-based back to the national office, the headquarters of the organization. And I'll tell you, it's a great question because it brings up a lot of things. And I remember the last time I made a move back, I had been the executive director of the New York City chapter of the March Times, and I was being moved back to the headquarters to run the development nationwide for the organization. I remember I had a terrific volunteer who worked on Wall Street and saw the job I had done in the New York City chapter, which was a real turnaround, and I'd been there for 5 years doing it. And the volunteer said to me, "Are you sure you want to do this?" And I said, "Well, what do you mean by that?" "Of course, it's a big promotion. I'm going to be over the whole nation." And they said to me, "Well, it's like you've been the captain of your own boat, and now you're going back to the Pentagon." And I got to tell you how right he was when he gave me that advice. I will also tell you that move from field-based back to headquarters, they say that President John F. Kennedy said when he became president of the United States, he said, when I worked in the Congress, I thought the White House had all the power. Now that I'm in the White House, I think Congress has all the power. And that's another lesson that I learned from that experience of moving from one to the other, because each has its own power base, and you get a perspective. I remember when there was a quote of JFK about that, and I had read it in the history books, and I thought, oh, that's interesting. But when I lived through something like that, I got what it meant, that your perspectives, they're different, and they tap different skill sets. So I would say moving between field-based and moving between headquarters, it's really good for your career in both directions, and you can do it more than once in each direction. One's more tactical, the other's more strategic, and that doesn't make one more important or one less important. And one, that field-based, you're much more utilizing your defined set of skills yourself, whereas going back into the headquarters situation, you're relying on the skills of others, and that takes another skill set. And again, I think I want to go back. I think Rebecca said this early in answering one of her questions, that testing yourself out in areas that aren't your comfort zone, that's where you grow the most. Not losing that skill set you had to begin with, but then adding to it. So, and I will say, for the going from the field to the headquarter, 3 pieces of advice on that just to take with you. Integrate the lessons learned. There's a lot you learned in the field. It'll make the headquarters better, even if it feels like the headquarters doesn't want it, okay? 2, the value of never losing touch. Just because you move into the headquarter, keep those lines of touch and communication and learning. Learning, so great what Dan was saying about being curious and doing, right? The learning, keep that going so that you don't lose that touch from the field-based experience. You'll make your leadership position so much better. And the other thing I will say, because I've seen a lot of people do this. I've seen people who've been very successful in a field base and then get into more of that national or global leadership position, and they come into it with more of a command and control approach, because here they are. They've been great at what they did in the field. They're going into the headquarters. Now I'm in charge. The command and control, I've seen more people fail on command and control versus integrate the lessons learned, never lose touch with what's going out in the field, integrate it in. And the last piece I'm going to say is that comes with that moving into the leadership positions is it's more politic. It just is. It's more political. To think it's not is a lie, and to put oneself in a position to feel uncomfortable about it, but learn how to do it. And I don't mean political like in backstabbing. I mean in political like you're in these leadership positions. they're very strategic, and only so many priorities by the organization can be taken on. So it's political as in influencing those at your level and those back in the field structure to follow what you're doing, that your priorities become the priority of the organization. Your integrated priorities that are connected to that field become the priorities of the overall organization. That's the kind of political that I talk about. And with that political, stay true to the work. If it's political to make you, your department, your whatever, the biggest and best it can be, well, I'm going to go to something else Dan said. He talked about humility. You're getting away from the humility. And humility matters in our field. It just matters. And it can be a tremendous asset for you. But if what you're doing in a political sense is to make the organization better, the organization more holistic, the organization more functional, more effective, then that's the right kind of political.
It's Rebecca. I want to weigh in just one thing on the humility. I agree, but I also would challenge that just a little bit to say, if you want to move, if you want to go into a different area, again, figure out, you may have to sell it to somebody to explain why your unique background, in textile design or in theater or in business actually is a really good fit. So humility for the magnitude of what we are facing in terms of global health, and for respect for the knowledge that others have within that field, but also I think a willingness to, again, challenge the status quo in a way that says, have you thought about this? I bring a different perspective, and that's a value and why. But it's up to you to sell that, to identify it, and then to sell it persuasively.
And if I can jump back in on that, I think 100%. And I wanted, in distinguishing all of that, first of all, there's a difference between ambition and humility, and both are needed and are terrific in nonprofit. So that ambition, that drive, you don't need to feel guilty about that, and you can lean into that. And I had to learn that. That took me some time, but it's a matter of fact, I had a tremendous boss at one point who said, "No, you've got ambition. That's good." And tie that into what's best for the organization, challenging the status quo, please, every day, but it's about making the mission of the organization better versus it's about my idea is the best idea. If you combine that ambition, drive, and the mission, that it's critical, absolutely critical. It's the only way our organizations improve.
Thank you both. Our last question is one that I think I will open up to all four panelists. Are there particular sectors or geographic areas where you expect to see growth in global health career opportunities over the next 5 to 10 years? Dan, would you like to start us off?
Sure. Yeah, I think this could also, you can make a counter to some of what I said before. The way in which big data is being looked at in global health and the sophistication of programs is just growing by leaps and bounds. And so I think there is always a role for us generalists and us policy and communications people who speak on that broader level, but that really needs to be informed by having the right answers and from finding patterns and answers that are not always obvious. And so going to conferences, I'm struck by how analytical a lot of the field is getting, and I think that is a great trend. But I think if I were to look for an area of growth in there, I would say that. I also think you'll see, and I alluded to this earlier, there is a lot of investment in building up R&D and drug discovery and operational research and clinical trials, et cetera, in developing countries. And I think the centers of gravity for a lot of investors will start moving toward there. And I think that is a wonderful trend that is happening, but I definitely see that continuing over the next few years as well.
Great. Thank you. Rebecca, would you like to respond to that question as well?
I absolutely would. I'm going to start by doing a pitch for anybody who's out there doing a dissertation or looking into research. Drowning is where you want to be. It is a chance for groundbreaking research. We don't have a lot of research. It's one of those, it is an epidemic that very few people are talking about, that we're starting to get attention and money towards. So it's a huge challenge. But again, that's something that you look inside yourself. What sort of person are you? If you're somebody who, like me, is happy to keep tilting at windmills on something that is not being talked about, that's my strength. Drowning, someplace like drowning is a good place to be. And so look for an overlooked global health issue. There are plenty of overlooked global health issues. And then break that down. Are you somebody that's more of a data? Are you a scientist? Are you a medical person? Are you an analysis? Are you interested in program delivery? Are you interested in getting in and really exploring the cultural barriers that are keeping areas from being successful? Or are you somebody who is more comfortable in an area in global health which has a higher profile? Does that fit more with your wheelhouse in terms of how you like to work? Are you interested in working with a much larger team? And so, as with all of my other answers, I think, is look inside yourself as to what sort of person you are, how you like to operate. Are you a more local thinker? Are you a global thinker? Are you more an actor, or are you a thinker? You know, what is your area? And then fit your skills. Identify the global health area that best suits that, because that's where you will make the biggest impact. And that's what we really need. We need people who are passionate about global health who can make a huge impact, because it will take all of us to change things.
Thank you. Eliza, would you like to weigh in?
Well, I wouldn't say I have a ton of experience in predicting this, but certainly from what I see, there's a huge rise in mobile health, and its focus on kind of smartphone-enabled providers all over the world, particularly in low-resource settings. And there's a huge focus on app design as kind of global health solutions. I don't always agree with that. It doesn't seem like the answer to every problem is in some kind of app that gives us more information. But certainly there is a huge focus on that. I would only hope that there's a growth in communications, and I think some of our other panelists have touched on this as well. Certainly in the nonprofit world, a lot of our communication energy often is directed towards funders and donors and kind of everything we do to keep our organizations running. But it seems like there's a very neglected area in terms of the communication and outreach towards the population. And I would certainly hope that there are more designers who move into this field, because it seems like sometimes designers aren't included in that conversation, and I think there's a big lost opportunity. And it gets to a question of health equity, because if you have a low resource setting or an area of low literacy, people's ability to access information, is not equal. And I think it's important to really focus on that sector as well.
Excellent. Thank you. Mark, did you have any thoughts about this question?
Yes, and also it's actually well-timed. I am just back from having spent the better part of 3 days in Washington, D.C. At the Milken Institute's Health Summit. So let me first start with the whole field of global health is where it's at, and I can assure you of that, of coming out of this conference, because there were a variety of themes. So just the fact that everybody's on this phone and in global health writ large is the place to be right now. I'm going to reiterate some things I've already heard and add one or two. Coming out of this conference, big data, smartphones is absolutely it. Geography, Africa, again, coming out of the Milken conference, so much of it. Population trends, need, emerging markets, technologies, all of that, Africa's there. The two big kind of areas that we talked a lot about, sustainability, and I don't think I'm telling people on the phone much or on this call much of anything they don't know, but the whole area, again, writ large, of sustainability, and define that in any sector you want, that's there. One that I think Dan touched on, but I want to come back to, and again, the larger category, the life sciences. There is no question that kind of as an economic driver worldwide, the life sciences, if you see what's going on in cancer now, there's just so much capital that's being brought to that. And I'm going to come back to kind of what global health would look like around that. I certainly see that in the life sciences and things like Alzheimer's and dementia. So take certain disease states in those life sciences that are trending and follow populations. As populations age, things like Alzheimer's and dementia becoming a bigger and bigger thing going forward. I will say that because Dan mentioned on the drug discovery, and that's something I'm part of, but the underpinnings, I'll just call venture opportunities in nonprofits in global health. And what do I mean by venture? And again, I think global health is perfectly positioned for this, is there are the nonprofits, the 501c3s, who are partnering with public entities, and I think that's so much of what global health is, but also with the private entities, having all three of those in a partnership to drive change, and in a venture philosophy whereby you're either generating sustainability out of that, or you're generating returns that go directly back into the mission, which is more of the science version of that. So I would offer those up as all areas. And again, just end with global health is an incredible place to be for the long foreseeable future on the nonprofit front.
Well, that is a perfect place for us to end our webinar. Thank you so much to all of our phenomenal panelists for sharing your insights and expertise today with our webinar audience. This concludes today's webinar.